my beautiful and lovely friends, this is Miriam again. Well, before I start today's tutorial, I have to tell you guys that thank you for liking my videos, subscribing me, and sharing your thoughts and feelings with me. Those likes and those subscriptions really help me to, get the energy and make you better videos, okay? Today I decided to talk about how to read the nursing book. For those of you that you're already in the nursing program, you already know what am I talking about. I'm talking about a scary, thick book that has too much information. And for those of you guys that you haven't started nursing program, I have to give you a warning to be ready to see something huge and thick. But, the good news is you are all smart because you passed the entrance exam and you finish your prerequisites, which are great, and they are going to help you in order to read this book. They are really good information in anatomy, physiology, microbiology, and stuff like that you're going to use those background knowledge when you're reading this book. So you're kind of ready actually. So, well, I know that different people have a different learning abilities, they have different preference to how to study the book and stuff like that. So please look at this video as one example, okay? So don't think that this is the best way. This is just an example. This is what I did and I really got a benefit from it, and I am going to share it with you. Maybe it's going to help you as well. Who knows, okay? So, before I start, I have to tell you guys, if you have anything like PowerPoints or notes that your teacher provided at the top of this book for you guys, please make sure that you read them first, because those are the points that your teacher think it's really important for the students to know, and guess what? They are important to know, so you should know those stuff very well, okay? So if you have a really limited time, so I really suggest to study those first, okay? And then let's go back to reading the book. If you are one of those people that you can read like the big chapter, like 100 pages of the one chapter, it could have 100 pages. I'm not kidding, okay? So if you're one of those people that you can read all of them straight and remember them all, I have to tell you, congratulations. You don't have to read, you don't have to watch this video at all. You just have to go and be relaxed because you're doing awesome, okay? But if you're like me, that you're nowhere close to reading 100 pages and remembering of it, and you have really short memory, then my tips might help you guys, okay? So for the start, I brought this book for you guys. This is Medical Surgical Nursing, okay? So this is really important book in nursing. It's like a holy book for us because we are going to use this book twice. We are going to use this book in Med-Surg semester, which basically we learn how to be a nurse in the hospital setting and take care of the people with diseases that they are not going to kill them right now, and they gradually will lose their health, but they are not in the critical condition. And another semester would be the critical care semester, which basically its name is so clear and it says it all. It means that they are critically ill and they are not hemodynamically stable and they need extra care. At the top of nursing care, they need too much machinery, technology, and stuff like that, okay? So we are going to use this book twice, so it's really important to know how to read this book, right? So for showing you how I read this book, I actually choose the chapter that my lovely teacher, Miss Nancy Cooper, wrote that, and I actually really love this chapter. It's about heart, which is my favorite, and I got 100 on my test, so I'm just so happy. I just love heart, so I read too much about it and I really got a good result. So okay, so chapter 37 of the Lewis book, it says inflammatory and structural heart disorders, okay? So this is how I'm going to do. I'm going to read all the titles first, and when I'm reading it, I'm going to, create some rationale for myself to say, to put those titles together and thinking what is going on in this big paragraph without reading it, okay? So I'm going to show it to you guys. So the title of this chapter is Inflammatory and Structural Heart Disorder by Nancy Cooper, right? So, and Dr. Mitchell, which is another favorite, and she was She was a dean of our nursing program, Dr. Mitchell. Okay, so here says, the first big title that I am going to see here, it says ineffective endocarditis, right? It's really hard for me to show the book since I am the only one who is recording and editing and stuff like that. So I'm sorry about that, but I'm going to read it, right? So it says ineffective endocarditis. What is the first thing that it's going to pop in your mind by just reading this title? First of all, it says endocarditis. You have to go back to anatomy. Endo means inside, the layer inside, right? Itis means inflammation. So endocarditis means inflammation of the heart. So the first chapter, the first paragraph of this chapter is talking about the inflammation of the heart. Am I going to read anything else? I don't know. No, I'm going to move to another title. It says classification. Oh, great. So we have different classes of endocarditis. That's all I need to know. I don't want to go through the details of the classification. And then here it says etiology and pathophysiology. I would stop here. I would love to know etiology and pathophysiology, because you can do too much just by knowing what causes endocarditis, right? So let me show it to you. Since I'm too lazy, I just read the first line of this paragraph. Okay, and I'm sure it's going to tell me all I need. So first sentence of each paragraph, it's actually kind of the summary of that paragraph. So here says, underneath of etiology and pathophysiology, it says, the most common causative organism of endocarditis is Staphylococcus aureus. Stop here. Is it anything pop in your mind? Staphylococcus aureus? Oh, we read that in microbiology. It's a bacteria. All you need is its bacteria. Well, if you remember too much, it's a circle shape and it's just a nasty bacteria. Staphylococcus aureus is not really easy to kill, but all you need is it's a bacteria. What you're going to do for the bacteria infection? You're going to give antibiotics, right? So you kind of know the treatment by just reading the first line of this paragraph. So am I going to read the next page, which is still talking about etiology and pathophysiology? Not right now. I just want to finish this chapter, so I will move on. Now, next title, it says clinical manifestation. How cool is that? Now, you should actually know what kind of manifestation this disease has. What are the signs and symptoms of this disease, right? So this is really important. So far we learned that it's inflammation of inside of the heart. Second of all, we figured out the most causative organism is a Staphylococcus aureus, and now we're going to figure it out. What are the signs and symptoms of it, right? Well, it's a big paragraph, but it has a picture on it, right? It has a picture here. This is all I am going to read, honey. I am going to read underneath of the picture. I'm not going to bother myself to read the whole paragraph. Underneath of this picture says bacterial endocarditis of the mitral valve. How cool is that? So those organisms are going to live around the mitral valves. Isn't it cool? So so far you figured out it's an infection of the heart. It's Staphylococcus aureus. Where are those infections? Are around the mitral valve, right? So now you know the location of those bacteria. So am I going to read anything? No, I'm too lazy. So I will go to the next title. It says diagnostic studies. Now I have to figure it out how I'm going to figure out those bacteria are around the valve. So for diagnostic, I always look for the picture. If there is any picture, no, I'm not lucky this time. So since there is no picture and no boxes, I am going to read the first sentence of this paragraph. It says, here, 2 blood culture drawn 30 minutes apart from 2 different sites. So see, it's actually, the diagnostic test is the blood culture. How easy is that? And you have to usually do it twice, because there's always one time a problem. So am I going to read why we are going to do it twice? No, I'm just going to use my critical thinking, which in my mind, usually when you repeat something twice, it's because of the error. You can get some sort of error when you do it one time. So you have to use another location to make sure in another location you're going to get the same results. I'm not going to read that. Maybe my rationale is wrong, but who cares? It makes sense to me. Okay, so then you move on. Oh, there's a box here. So you should always read the box. And by the box, I mean this stuff. right? So there are two boxes here. One of them says situations requiring antibiotic prophylaxis to prevent endocarditis. So see, first of all, it says antibiotic. So you are right by guessing that the treatment could be antibiotic. Second of all, it says prophylaxis. Prophylaxis means to preventing getting that disease, right? So you should know you're not, the patient is not going to get endocarditis from nowhere. So something should be happening first, then it's going to develop and complicated as endocarditis. So usually that thing should be any bacteria somewhere else that goes to the blood and then goes to the heart, and the end result would be endocarditis. So this is the rationale that you're going to thinking by yourself without reading anything, right? So in my mind, since I saw the prophylaxis, I have to think, okay, so probably I have some infection, sort of infection somewhere in my body that goes to the blood and then goes to the heart and makes a big problem, right? And then just go and read the title in the box. It says oral and respiratory. Done, you are done. You don't even need to read the box. Oral means some problem with your teeth, and respiratory is obvious. You have some infection in your lungs, right? So if you have any problems with your teeth, you have a bad teeth, you have a infected teeth, or you have a respiratory problems, it can go to the blood and it can go to the heart. So you actually learned so many things and you're done. It was these things that I taught, it was about 6 pages of this chapter, which are too much, in 6 big pages, big paragraphs and everything. I just read a couple of the sentences and I got the clue what's going on, right? So this chapter was about different infection of the heart. One of the infection was endocarditis, which means inflammation or infection of inside of the heart. And most likely it will be caused by a Staphylococcus aureus, where around the valves. What can cause it? Another bacteria infection around other part of the body. What are the diagnostic tests? To sample of the blood. Well, actually, I saw another things about X-ray in another paragraph. So, you know, if you're just reading, you know, another paragraph line, first sentence of another paragraph, you will see a chest X-ray as well. You're done. You know what it is, what's causing it, what are the complications. You know everything by just reading few sentences. How awesome is that? So that was my tips. That was how I studied this book, and I hope my my tips going to helping you guys. And please like me, subscribe me, and share your thoughts and feelings to me, and tell me, is this video going to help you to study better or more effectively? I hope it does. But please share me how you are studying this book or how you studied this book, and share your thoughts and feelings with us, because it's going to help another student nurses. So I love you all and I wish you the best. Please take care of yourself. Bye-bye.